I was thinking about the US leaving the World Health Organization, and suddenly my mind just kept connecting things: mosquitoes, climate, melting permafrost, and I realized none of these are separate stories. On January 20th, 2025, President Donald Trump initiated the United States withdrawal from the World Health Organization. This decision became formal on January 22nd, 2026, after a mandatory 12-month notice period. The U.S. became the first nation in history to leave the global health body formally. The Trump administration provided several key reasons for this significant move. They publicly argued that the WHO had severely mishandled the initial stages of the COVID-19 pandemic. This included what they perceived as delayed warnings and policy advice that seemed overly deferential to China. Another core argument was the WHO's alleged failure to implement crucial reforms. The administration claimed the organization resisted necessary changes that would enhance its effectiveness and accountability. They also cited concerns about political influence, accusing WHO leadership of being subject to inappropriate pressures from member states. Finally, the U.S. pointed to perceived financial inequities. They highlighted what they viewed as disproportionate financial obligations, with the U.S. contributing significantly more than many other large countries. This withdrawal aligned with a broader policy approach, prioritizing national control and bilateral relationships over multilateral institutions. Supporters of the decision argued the U.S. should manage global health partnerships directly rather than through a large international bureaucracy. However, this move faced sharp criticism from public health experts and global leaders. Many argued that the WHO's role in worldwide disease surveillance and response is essential. Leaving the organization, they contended, weakens the U.S.'s ability to protect itself against emerging threats. The U.S. departure also created a significant funding gap and potentially diminished American influence on global public health policy. Many experts emphasize that global health cooperation is not a luxury, but a necessity, as diseases do not respect national borders. COVID-19 served as a stark reminder of this reality. Consider mosquito-borne diseases like dengue, now endemic in over 100 countries, or Zika, which crossed continents rapidly. West Nile arrived in the U.S. and never left. Malaria is re-emerging in regions where it had been eliminated. These examples illustrate how interconnected global health truly is. Mosquitoes do not stop at customs. Neither do birds, bats, or human travelers. Once a pathogen finds a vector, national boundaries become irrelevant. Basically, this proves that you can't be a lone wolf when it comes to public health. You cannot opt out of shared air, water, or ecosystems. Interdependence is fundamental to life itself. That is precisely why global disease surveillance matters so profoundly. Early detection in one country can protect every country. Shared data saves precious time, and time saves lives. Coordination is not about control, it is about achieving collective situational awareness. If countries aren't cooperating, the holes that form aren't secure, they're just blind spots. Pathogens, unfortunately, thrive in these blind spots. This recognition reflects a grounded ecological understanding of our world. It acknowledges that survival is a shared project regardless of political preferences. This intricate web extends beyond immediate disease outbreaks. Melting permafrost, for instance, releases ancient biology. Dormant bacteria, old viruses, and spores our immune systems have not co-evolved with. Cases like anthrax outbreaks in Siberia highlight this risk. What we experience as climate change is better described as climate destabilization. This instability fuels the expansion of mosquito ranges, creates droughts leading to water scarcity, and causes floods that contaminate supplies. These are not single events, but cascading health risks. Furthermore, pollution does not stay contained. Heavy metals, microplastics, and agricultural runoff move through soil, water, plants, animals, and ultimately, us. If animals are struggling due to habitat loss or toxins, diseases can spread like wildfire, upping the chances of them spreading to us. We are not facing separate crises. We are confronting an interconnected polycrisis encompassing ecological, biological, social, and infrastructural challenges. It's tough to explain how things are linked because systems are separate. Just because we're linked doesn't mean we're more at risk. Instead, it reveals powerful leverage points. The same interconnectedness that spreads risk also allows for early warning systems and coordinated responses. Ecological restoration and water protection become vital strategies for health. Climate mitigation itself is a public health strategy. We're not just spinning our wheels, we're figuring out the important stuff. History has always been shaped by invisible forces: climate, microbes, water. The difference now is that we can see the patterns and decide how we respond.